Good afternoon, everybody. I'm Doug McGowen with the City of Memphis, here representing the Joint Task Force for Memphis and Shelby County. Going to be providing you a bit of an update today, and I'm joined with the Deputy Director of Shelby County Health Department, Mr. David Sweat, and also the Director of Community Services for Shelby County, Ms. Dorcas Young. Well, today's a pretty special day for us at the task force. Though it may seem longer to many of you, today represents exactly 6 months since we began this journey together. We had our first case of COVID-19 back in March of 2020, and since that time, we've seen our case rate rise as high as 400 cases per day. Now, thankfully, that number has fallen, thanks to the great work of everybody in our community, to nearly 100 cases per day. And we've also seen hospitalizations go as high as nearly 400 per day, and today we're roughly half that number, just about 200 people in the hospital. So what that tells us is that what we are doing is working. Thanks to all of you for complying with the health directive and the ordinances that have been put out by our various leadership. It's working, but we are clearly not out of the woods yet. We have to stay the course in order to get our positivity rate down into the single digits and to get our case rate down into the low double digits and into the single digits as we move forward. Now, the actions that we've taken to get us where we are today haven't come without any impact to our community, and we are well aware of that. So the thing I'd like to give you an update on today is the help that the City of Memphis is providing to individuals and to companies that have been impacted because of interruptions in businesses, layoffs, or interruptions in your ability to make a living. Now, for individuals, there are 3 programs I'd like to talk about today for help with you to meet your obligations. And the first is through MIFA, the Metropolitan Interfaith Association. We have a grant program with the City of Memphis. They provide support to citizens year-round, but the City of Memphis, Mayor Jim Strickland and the Memphis City Council have added about $3.5 million to MIFA's ability to deliver services. The program that we have put into place will help you with rent assistance, mortgage assistance, or utility assistance. And to start, that can provide up to $800 of assistance to individuals who are in need. If you want to apply for that program, you should go to mifa.org. The second program is for individuals who are in our hospitality industry. There's an organization called Welcome to Memphis, who's an advocacy organization for people in the hospitality industry. They've partnered with the City of Memphis to provide benefits to individuals who have been affected by COVID pandemic by obviously, they have not been able to work in the restaurant field. They haven't been able to work in other elements of hospitality industry. And so Welcome to Memphis will offer up to $300 of assistance to individuals who've been adversely affected due to COVID-19. You should apply for that through welcometomemphis.org. I think the information is on your screen. The third program I'd like to talk about is for our artist community. We're very proud of our artist community, but we also know that they have been dramatically impacted due to the impacts of COVID-19. And through a partnership with Arts Memphis, the City of Memphis is offering assistance up to $1,000 for artists who have been adversely affected by COVID-19. Apply for that through artsmemphis.org. Now, not only individuals have been affected, but obviously small businesses have been adversely affected disproportionately compared to big businesses. And we're sensitive to that. And through the Memphis Office of Business Diversity and Compliance, we are offering the Business Stabilization Grant Program. Now, that office is located in the old Universal Life building, which is on the corner of Danny Thomas and MLK. You can access that through memphisbdc.org. And the program will offer grants typically ranging between $10,000 and $25,000 of assistance to businesses who have been adversely affected through business interruption due to COVID-19. I realize fully that I've just given you a lot of information, a lot of different websites. One that you're probably most familiar with is covid19.memphistn.gov, which is the information hub for all COVID information for the City of Memphis. All of these programs and the links to the various programs will be located there. And so I encourage you to take advantage of these opportunities if you are in a category that allows you to do that. I'll now be joined by Deputy Director of the Shelby County Health Department, Mr. David Sweat, to give you an update on where we stand with respect to the pandemic.
Thank you, Chief. And just to give you an update on others that are with us today, I'll be followed by Dorcas Young, the Chief of the Director of Community Services, who will bring you up to date on available assistance from her organization or that she wants to refer to. And we also have Director Haushalter and the local health officer, Dr. Bruce Randolph, with us available to answer questions later if questions come up that they should address. As far as where we are in the epidemic, we have 28,652 cases that have been reported so far, and that's an increase yesterday of 105 new cases. We're at 405 deaths, and the median age of death is 74 years, meaning that half of the people who have died are 74 years or older, and then half of the people who have died in the epidemic are younger than 74 years. The full range of ages of death are 13 years to 100 years. We have 1,572 active cases in Shelby County right now. That means that there are that many people who have been diagnosed with COVID-19 disease in the last 14 days. And our positivity rate is at 11.5% right now. So that means on any given day, about 11.5% of the tests that are obtained are testing positive. We do have broad and easy availability of access to getting tested. So anyone in Shelby County who has symptoms, anyone who has been exposed to a known case, testing appointments are available. We have over 9,500 available test appointments through our community test sites every week. And we would encourage anybody who may need to be tested to please go and be tested. We have diagnosed so far 2,707 pediatric cases, and that represents 9.5% of the population of infected individuals. So 9.5% of the cases that have been diagnosed have been among pediatric cases or pediatric individuals less than 18 years of age. So we will continue to watch that as schools have reopened now and monitor for whether that stays stable, whether that decreases over time or increases over time, something that we're very interested in observing. In terms of the distribution of cases, 63% of the people who have been diagnosed with COVID disease are less than 45 years old. And 54% of the people who have been diagnosed in Shelby County are between the ages of 18 and 54 years old. So COVID-19 is attacking our young adults, is attacking our healthy young adults and younger population to a greater degree, but it poses the greatest risk to death for people who are over 55. In terms of the distribution of disproportionate impact, 79% of the cases have been diagnosed among people who are either Black or Latinx. And so we know that our minority population in Shelby County bears a disproportionate share of the burden of disease and have for the entire epidemic so far. In terms of our fatal cases, 41% of our fatal cases have had a comorbidity or a risk factor of diabetes. 19% have been obese. 28% have a respiratory condition of some kind, which could be asthma, COPD, emphysema, or other lung disease. And 78% of the fatal cases have had a cardiac problem. It could be as simple as high blood pressure, but some sort of a heart disease indicator. And we know that these four comorbidities or co-risk factors have been the most important ones stably throughout the epidemic. We always want to bring that to attention, mainly to emphasize that if you happen to have any of those risk factors, that it's important for you to take very seriously the measures that you can perform on a daily basis to protect yourselves from COVID-19 disease. Wash your hands frequently, use hand sanitizer, always wear a mask in public, avoid large gatherings, and in general, if someone else can run your errands for you and be out in the world for you, it's always a recommended action on your part to reduce your risk. And 89% of the people who have died have been 55 years of age or older. So I want to emphasize there that you don't have to be very old in order to be at an increased risk of mortality. 55 years old is not very old. And that is where the increased risk of mortality begins. So with that, I'm going to turn it over to Director Young to talk to you about the available assistance for those of you who may need additional assistance at this time.
Thank you, David. Good afternoon. Again, my name is Dorcas Griffin, and I serve as the Director for the Division of Community Services for Shelby County Government, and I'm also a member of the Joint Task Force. Just as we have continued to collaboratively tackle immediate public health consequences of COVID on this county, it has always been top of mind for all of us the tremendous economic, social, and emotional implications for residents of Shelby County over these past 6 months. As a part of today's briefing, I want to share with everyone some reminders and resources as we continue our efforts to address needs that continue to rise. On this past Friday, on September 4th, the federal government established a temporary halt on evictions across the country. Tenants who make less than $99,000 a year, who are not able to pay because of substantial economic loss, and they have notified their landlords of their inability to pay, are eligible under these protections. It's important for all of us to note that any rent and any fees that are owed during this time and even before do not go away. The halt does not make the fees go away. They will still be there for us January 2021. To that end, I want to encourage all tenants to continue to pay what they can and what you owe if you can. And if you do need help, I encourage you to access some of the many resources, some of which you heard Chief McGowen mention, and others like the Eviction Settlement Fund that can help you during this time to get stabilized. If you want more information on any of the programs like the Eviction Settlement Fund, of course you can reach the COVID website that was mentioned earlier, and you also can go to home901.org for more information. The other thing that I want to mention is that we have had, of course, an increase in people needing help with utility assistance. We have worked hard with MLGW to address these issues. MLGW has worked with us to make sure that customers know options that they have, and they've also extended the moratorium of cutoffs. That moratorium does end on September 14th. As that moratorium is coming to an end, I want to continue to encourage our citizens to make arrangements with MLGW. You can call 544-6549 to make these arrangements. You can arrange to pay a portion of your bill. You can arrange to pay monthly towards debt that is owed. They want to work with you to ensure that we can keep the lights on. If you still need help outside of the payment arrangements, of course, we want you to contact MIFA at MIFA.org to get more information about the programs that they have, as well as the Shelby County Community Services Agency. And you can reach us there at shelbycountycsa.org. Finally, I want to mention during this time, I read an article yesterday in the New York Times that said parents are in a mental health crisis during this time. I would offer to us that many of us are feeling the emotional impacts of COVID during this time. We recognize that this has been a heavy burden for everyone to carry. To that end, the state of Tennessee has funded an emotional support line for anyone who is looking for any level of help during this time. 24 hours a day, 7 days a week, you can be connected with a counselor just to have someone to talk to during these trying times. That number is 1-844-507-0144. I encourage us all to utilize this resource as we continue to fight through COVID together. Thank you.
Hello, can you hear me? Yes. Hi, so my question is, with Halloween just a little over a month away, I know in Los Angeles, they canceled trick-or-treating. Do you believe that's something we could see here? And what advice would you have for parents should they not have their kids go out and trick-or-treat this year?
Thank you for the question. There are no plans at the moment to try to cancel, quote unquote, Halloween. However, we do have our communications staff working on some information packets that will be distributed to two specific groups of audiences. One is to parents and individuals on measures they can take to protect themselves during the fall festival and Halloween season. And then another for organizations that may be planning to host either Halloween events or a fall celebration festival of some kind. And all of that information will be forthcoming. But we do have our communications teams working on putting together some information packets and guidance documents that will be shared soon.
Thank you.
Kendall Downing, WMC.
Hey everyone, I have two questions. The first is about the school dashboard that the state put out yesterday. Is this the method that the health department will use to notify with respect to cases in schools, or are you all still looking at putting out your own notification with the number of cases in a community area? And then I have a follow-up.
Well, our effort has been, in terms of displaying the visual information, is to parallel the state, but we share the information on the number of cases among school-age children, primarily with the mayors of the various municipalities. At this point, we have not made provisions to for instance, post a website about that, but the information will be updated and shared as appropriate as needed.
And then my follow-up is about the return to athletics for Shelby County schools. I was interested in the conversations. Can you all talk about any conversations that you've had with Shelby County schools about trying to return to athletics as some other districts have done? Thank you.
I'm going to invite Dr. Randolph to come and speak to the issue of athletics because he's been involved in more of those discussions than I have. So Dr. Randolph, please join us.
Thank you, Mr. Sweat. Greetings, fellow citizens of Shelby County. The answer to your question is we have not had direct communication with Shelby County schools pertaining to athletics, but our position is the same. We still view contact sports where there's close contact and increased transmission or risk of transmission of the virus to be a high-risk activity, and we currently are not encouraging that at the time.
Greg Akers, Memphis Business Journal.
Hi. The testing numbers in the past few weeks are really quite reduced from what we saw earlier in the summer. How concerned are you that underutilization of testing means that we're missing cases, and with the kind of lower case count, possibly creating a false impression that things are going better than they really are?
So thank you for the question. At the moment, we're averaging around 1,500 or 1,600 tests reported to us per day, with about 100 of those, or a little over 100 of those tests being positive and the remainder being negative on any given day. But what we calculate the positivity rate on is based on the specimen collection date, not the date of report. In terms of how concerned are we? I think our concern level right now is that we believe that the testing data does tell us what is going on in the community in general, but we want to make sure that the investments that have been made and the work that's been put in place to create an infrastructure for testing is utilized by the citizens. And so that's why we're advertising that we've got appointments available, and anybody who needs a test, please come get one. But the distribution, given that level of a sample, 1,500 a day, is a good enough sample that, as far as for surveillance purposes, we can detect where in the community the virus is spreading more rapidly and more actively. And we do see at this time, inside the I-240 loop, there is a reduced level of virus transmission. It's not gone by any means, but there's a lower positivity rate associated with many of the zip codes, or most of the zip codes inside the 240 loop. Where we are seeing higher rates of positivity are all the communities on the outside of the 240 loop and moving eastward through the county and northward through the county. So in places like Germantown and Millington, Bartlett and other areas, Collierville, we're beginning to see that there is increase in the positivity rates of tests that were collected in those areas compared to previous months. So for surveillance purposes, the amount of testing that's going on is able to show us how the virus is moving in the communities. But in terms of our concern level, I think what I'm most concerned about is that 6 months is a long time. And we've been doing this for 6 months. And the major risk we face is complacency or fatigue with COVID. And as far as our individual health risks, it's still there. And so we would still encourage anybody who begins to have any difficulty breathing, has sudden and unexplained headaches, feeling fatigued or malaise, develops a sore throat, any of these kinds of symptoms, gastrointestinal distress, any of these kinds of symptoms could indicate COVID-19 disease. And testing is easily available, easy to access. Lab turnaround time is very short right now, 1 to 3 days. In fact, all of the labs in Shelby County are reporting less than 2-day turnarounds. So at this point in time, if somebody feels that they should be tested or is having any symptoms, we would encourage you, please go get tested.
Thank you. My follow-up, earlier this week, there were 161 tests reported, and that was a reporting glitch. And it looks like Wednesday there was 121 tests reported. Was there another glitch, or what is going on with that?
Yeah, it's not so much a glitch, but what it is the data flows continuously all day long. So either electronically or by paper lab reports faxed into us, we are constantly getting data about lab reports. But for the purposes of updating the website, that is a data pool at a specific moment in time. So it's a snapshot throughout the day. And some laboratories do seem to have a practice of transmitting their positive data first and then their negative data afterwards. And if we happen to pull the data in a certain time frame when a lab has done that, put in a lot of positive tests but haven't given us their negative tests for the day yet, that sort of thing, it may look like there's a spike in positivity rate. But remember, we do not calculate positivity rate based on the report date. And so that 160 or 120 or 105 results that we receive represents data from many different dates of collection. And we calculate our positivity rates based on what day the specimen was obtained, not the day it came into the health department. And as I say, after we've pulled data for the website update, we're still getting data the rest of the day. So at any given moment in time, that number doesn't, it's not a, it's impossible to capture an accurate number in a constantly flowing data river. It's going to be an estimated number based on a specific moment in time.
Jane Roberts, Daily Memphian.
Could you tell us when we can expect numbers from the private schools on the dashboard? And then I have a follow-up.
Once again, we are not planning to publish a specific school district dashboard. What we are telling the mayors of the municipalities, the number of cases that are diagnosed among school-aged children in their jurisdiction. And there's multiple reasons for that. There's lots of overlapping school districts, and the important thing is the number of children in a community that are testing positive, regardless of which school district or system they may participate in.
Jane, did you have a follow-up? Jenny DePrizio, Local 24.
Hi, I have two questions actually. First is, this is for someone from the health department, Dr. Randolph or David Swift. A week ago today, I did a story about a woman who passed away in February, and she got a test result, her family did, in last week, saying that she was COVID positive. It ends up that that was a mistake that was made somewhere in the system. The statement that I got from the health department was that basically it was a mistake, and that they are changing protocols so this type of thing doesn't happen again. What exactly went wrong in that situation, and what protocols are being changed so that this doesn't happen to another family? Then I have a follow-up.
I'm going to let the director of the health department, Dr. Haushalter, answer your question.
And thank you for the question. What we understand after we investigated what had been reported in the media is that this is an individual who was tested at the time of death and had a preliminary positive test. If everyone remembers, way back in February, tests were actually sent to the Centers for Disease Control for confirmation. So that specimen was subsequently sent to Atlanta and read out sometime late in June. Ultimately, it was reported through the system to us as a positive test. Our team members have a protocol, so as soon as they received a prompt for a positive test, that particular case gets put in the system to work for contact tracing as well as notification. The individual who received the report did not double check the system to understand that that person was deceased. So it was an error on our part. What we've done to correct that is really additional training of our staff. I think everyone knows we have a significant number of new staff. Additional training of the staff that even though it's protocol driven, that you have to look at the whole context of the case. I did follow up with the family to make sure that they understood that the error was really multiple parts of the system, but ultimately we communicated with the family, so the error was on our part, and that we apologize for that and would take action to correct that. Additionally, as staff members have questions, those will be elevated to David Sweat, so that if there's a question of whether to give notice or not, the individual employees are involving someone in leadership regarding that decision. And then you have a follow-up question?
Was the health department ever involved, the Tennessee Department of Health? Because the letter he got said it was the Tennessee Department of Health.
So keep in mind, the way the reports come in for COVID specifically, so it's not the same as other infectious diseases, the notification goes to the state health department, and then from the state health department to us. And so it did come into us initially as a positive report, and that notice came from the state health department, and their notice came from the Centers for Disease Control.
Katie Reardon, WKNO.
Hi, yeah, this question is for David. Can you speak to why you've seen this increase in the positivity rate in Germantown, Millington, and Collierville that you mentioned earlier?
Well, the virus moves, and it moves as people are interacting in different ways that give the virus an opportunity to be acquired. And so in terms of specific reasons, there's no specific reason, but what we would say is, in general, the things that can protect us are wearing a mask in public at all times, practicing social distancing, avoiding large gatherings, hand washing frequently, work from home if you're able to do that, all those measures. But it's just maintaining the, just sustaining in a marathon fashion, that ingraining these things into our life as just things we do every day. And at any point in time, in any of our communities, if any of us become more relaxed, stop wearing our masks, stop washing our hands, start attending a large gathering that we maybe would have avoided earlier, any of those kinds of behaviors just makes it possible for the virus to find hosts more easily. But definitely what we do see is, and also saturation, you know, in any population, the people who are most easily infected by a virus or a disease as it moves through a population, the ones who are most easily found are going to be found first, and then later, people who are more difficult for the virus to reach are the ones that they're going to find. So what we've just seen in the recent months, the past 6 months, is that a lot of the COVID transmission has been in the core of Memphis, but now the virus has expanded. And we also see that in rural counties in western Tennessee. Right now, across the state of Tennessee, the virus impacted our big cities first: Knoxville, Chattanooga, Nashville, Memphis, Jackson, Sullivan County. I mean, the more populated areas were hit hardest first, and the more rural areas were not as heavily impacted initially. But if you look on Johns Hopkins website or the state of Tennessee websites or COVID Act Now websites that track the spread of COVID-19, what you do see is rural communities now, areas outside of the major population centers, are the areas where the virus is actually accelerating its transmission. And I was looking at that this morning on some maps, and you see West Tennessee in general, all of the counties in western Tennessee are showing evidence of active transmission in rural areas. So it's just the virus moves through the population. Major population centers tend to get hit first with respiratory disease, but the virus spreads into other areas over time.
We are out of time. Are there any closing messages?
Just stay the course. 6 months has been a long time, and we're not out of the woods yet. But there is good news. Our numbers are improving, and what we're doing is working. So please, all of us come together, stay the course, and we will get through this together. Thank you.
Thanks, everyone.